So we move from antidepressants to antipsychotics. And here we want to start with second generation antipsychotics first, because these are more commonly used, more popular, and used across different psychiatric indications. Some of these medications you might be already familiar with, like Abilify is a frequently prescribed one, Rexulti, Vraylar, Clozaril, clozapine, Zyprexa, olanzapine, Seroquel, or risperidone, or Invega. These are the ones that are more frequently prescribed. Mechanism of action of second generation antipsychotics. So in general, how antipsychotics work is mainly through antagonizing or basically inhibiting or blocking D2 dopamine receptors. And in case of SGAs, they also has an additional impact on the serotonin pathway. So it's mainly through dopamine, but also in second generation antipsychotics, they also work on serotonin pathway. So below there's this table of a general simplified basically version of how basically what pathways are involved in psychosis and some other basically medical aspects of some other basically pathways that dopamine is involved and how these medications impact them. So there are four pathways that are important here for dopamine pathways, and these medications impact all of those four pathways. We would want to skip the details of various mesolimbic pathway or mesocortical pathway or the other ones. But what's important here is that is to know that these medications decrease dopamine in one of these dopaminergic pathways, and that is believed to lead to decreased symptoms of psychosis, decreased positive symptoms. So in the mesolimbic pathway with decreased dopamine, we have improvement in hallucinations and in delusions. There is this other distinct pathway, mesocortical, where the same dopamine antagonism leads to increased dopamine. And this is believed to be helpful with negative and cognitive symptoms of psychosis, like blunt affect, thought disorganization, and hedonia. There's this other pathway, nigrostriol pathway, where, again, the same dopamine antagonism can cause adverse effects, extrapyramidal adverse effects, which are common in antipsychotics. These include tremors, muscle rigidity, tardive dyskinesia, which is a specific kind of movement problem that appears later in the course. And the other common side effect that you may have already heard from some of your clients is the prolactin elevation and lactation basically. That is coming from the impact of basically D2 antagonism in infundibular pathway, basically. So these are frequently these are a very hot area of research currently, how to invent new antipsychotics that would more selectively work on certain pathways and thus improve their efficacy and decrease the adverse effects. Indications of second generation antipsychotics, so they are FDA approved for schizophrenia, schizoaffective disorder, for mania, depression, and maintenance phases of bipolar disorder, and also treatment-resistant depression. Off-label use, they are used across the board for OCD, anxiety, in borderline personality disorder, in PTSD, and in delirium and agitation. So they are pretty much used for any psychiatric indication. Considerations when it comes to second generation antipsychotics. So usually they show their impact, some of the symptom domains in less than an hour, like when it is about agitation or irritability. In certain types of psychosis, like substance-induced psychosis, they may quickly show an impact on hallucinations and delusions. And there are other symptom domains that may improve after days to weeks, like thought disorganization, emotion dysregulation, mania, severe anxiety, severe obsessions. And there are some of them are used to help with insomnia also in psychiatric disorders. Side effects. Some of the side effects are may show up immediately. Some of them may take some months to show up. There's there's sedation, hypotension, antihistamine, antihistaminergic effects like dry mouth, constipation, urinary retention, weight gain, prediabetes, increased prolactin secretion, as I mentioned. Parkinsonism basically is muscle rigidity, akathisia or restlessness, tardive dyskinesia, and clozapine causes decreased white blood cells, which is a serious one. Um, and for that reason, it needs additional monitoring. In terms of workup, for any when we start an antipsychotic, we usually get an EKG. We do frequent weight monitoring. There's going to be a semi-annual or annual lipid panel, complete metabolic panel, and in case of clozapine, which is one of the strongest antipsychotics, which is used in very treatment-resistant cases, we have to also do additional CBC checks to make sure that white blood cells do not decrease below a certain level.